Hello and welcome to my week 2 video. In this video, I'll be discussing the steps you'll need to take as an MRI technician to set up your patient for an exam. This will include how to prepare the scan room for a new exam, how to go over the referral form for the exam, how to properly identify and greet your patient, how to introduce yourself before you bring them back into the scan, and of course, I'll be going over why it's so important to follow all these steps. Now, before we just call our patient back, we have a couple of important steps to do. The first thing you want to do is check the referral form for the MRI exam. This is extremely important as you want to make sure that you're doing the correct exam on the right patient. You're going to be checking that the order is properly filled out to include what body part you will be scanning, whether or not the doctor has ordered contrast with the scan, and you want to check that the order has been signed by the doctor. Now, you'll have an electronic order that will be found in the RIS, or otherwise known as the Radiology Information System, along with the physical form. So you want to make sure that you check the electronic order as well as the actual signed order. The signed order is a legal document which allows you to even perform the exam, so accuracy is key. Our next step, and one step closer to scanning our patient, we want to remove any potentially ferromagnetic or metal objects off of us before we enter zone 4. So before entering zone 4, you want to give yourself a good pat down to make sure you do not have any metal objects on you. This includes your phone, keys, watch, jewelry, all the way down to your wallet. You want to safely lock up any of these items before entering zone 4. Now that we've checked ourselves for any metal objects, we're good to go. The referral form looks good, looks accurate, it's signed. Let's go into the scan room to prepare for our patient. So it's mandatory that before each and every single scan that you are disinfecting coils, cushions, pads, changing bed sheets, pillowcases. You want to make sure the room is in pristine condition. You also want to make sure that you're locking that scan room door behind you. Moving on from that, you want to make sure that you're disinfecting the headphones that the previous patient has worn, down to every last detail that you need to disinfect. Have your linens laid out in the scan table on the lowest setting so that your patient is cleared, so that once your patient is cleared to begin the scan, they're ready to lay down and follow further instructions. Having a messy scan room that is not set up for your patient may leave them second guessing having you do their scan. Just put yourself in their position. You're going to get your MRI done, and the scan room is just a complete disaster. You would not have much faith or trust in that technologist to conduct your scan. So after your scan room has been disinfected, coils, the table, any wedges, cushions, everything's disinfected. You have fresh pillowcases, fresh sheets on the scanner. You verified your order for the exam. You have absolutely no metallic objects on you. It's almost time to go get your patient, and you may be asking why almost. There's one huge step that you must remember each and every single time you leave the scan room. Shut the scan room door. Before you head off to get your patient, you need to lock zone 4. That door needs to be shut. This will prevent anyone from wandering into this zone, especially someone who may have potentially ferromagnetic objects on them. Let's say someone's in an MRI unsafe wheelchair, or they have an oxygen tank on them. Just imagine having the loss of someone's life on your shoulders. Negligence is not worth the risk of ending someone's life. So now here we are. We have checked our referral. It's correct. The doctor signed it. The scan room is set up with the door completely shut and locked. You have no metallic objects on your person, on your body. You're ready to go get your patient. Now, as your patient checks in for their exam, they will be given a screening form to fill out. They should be filling this out as you set up for their exam. The purpose of this form is to verify that your patient is cleared and completely safe to be scanned. When entering zone 4, depending on where you will be working, you will either call your patient up by their first or last name. You want to verify by asking them to state their full name along with their date of birth. You may even go farther and ask for a driver's license, but the top 2 identifiers are their first and last name and date of birth. If it seems like they want to discuss the reason for their scan further, take them to a private area or take them into zone 2. Patients have a right to their privacy. So once they've done so, introduce yourself. They also have a right to know who will be conducting their care. Give them your name, your role in their scan, as well as how long to expect the scan to last for. You want to be also asking those airplane questions as you're interviewing them and going over that screening form. You can ask what brings them in for an MRI, if they're experiencing any pain, and if so, where. You want to be as thorough as possible because you are the eyes and ears after all. You want a brief review of their symptoms and why they're in for the scan today, essentially. Now, before you have your patient change, and sometimes even afterwards, you want to be sure you're asking them if they need to use the restroom before the scan. Number one, for their comfort. Number two is because if they're moving around a lot because they need to use the restroom, it's going to cause artifacts in your images, and this might delay your scan time, which can interfere with the scheduling of your next patient. So be sure that you're asking if they need to use the restroom. Keep offering it. Now, the next step to completing the exam is to have your patient lock up any metal objects that they may have on them. So the same demetallizing that you went through, your patient needs to go through. So you want to have them lock away any jewelry, watches, belts, cell phones, keys. Again, the same way that you demetallized yourself, you need to do for your patient. You want them to change out of their street clothes to prevent the risk of any burns or artifacts that may happen during the scan. Some clothing may cause burns to the patient's skin. Zippers can cause burns as well as artifacts in the images, so the best way to go is just have them change into a gown. Now we finally have all of our steps completed. We shut the scan room door, the patient's been interviewed and screened, everything's good and disinfected, the order form matches the patient's clinical needs. So let's do our scan. Now once your patient enters the scan room, have them sit down at the already lowered scan table. You want to try to find a spot for them so it's easy for them to lay into the coil for the scan. As your patient lays flat, you may want to raise the table so it's able to lock in with the coil that the cradle connects to. The table will just slide in after this. Now let's say you're going to be doing a scan of the spine. Almost every single time a patient lays supine for a scan, a cushion will be provided under their knees. This is just to reduce the risk of motion artifacts in the scan. A wedge or a pillow will work just fine. You want to set them up with hearing protection or noise canceling headphones, as long as they have some sort of hearing protection. You also want to provide your patient with an emergency squeeze ball to which you will instruct them to squeeze if they need to be given attention at any time. Now, to boost patient comfort, you can offer them a blanket if they may be cold. Again, you can remove this if they start to heat up once those RF pulses start coming in. But patient comfort should be your priority. You want to make sure that they're not feeling claustrophobic before you leave them in the bore to start conducting the scan. So yeah, make sure your patient is comfortable. Now, some patients may suffer from claustrophobia. You can provide them with a sleeping mask or a simple washcloth just to cover their eyes during the scan. If a family member assists them after being screened, they can be allowed into the room as well, or another MRI technician. So again, you want to make sure your patient is as comfortable as possible before you conduct the scan. Now, the biggest risk in MRI is not screening your patient correctly. This is vital. You do not want the weight of a patient losing their life on your shoulders. You want a written and a verbal interview for each and every single patient. You want a clean department to keep the health of your patient at the utmost importance. And most importantly, you want accuracy for each and every single scan. Make sure those the referral forms are accurate and signed by the doctor. Make sure that the room is disinfected. Make sure that you are demetallized, and most importantly, make sure that you are shutting that scan room door to zone 4. You literally want to know your patient inside and out. So thank you for allowing me to explain how an MRI is conducted.